Traditional dentures. There's still a place in this world for traditional dentures, but there are probably somewhere between 35 and 50 million adults in the US that have missing teeth. And so it's still a big part of our dental field. 50 years ago, the original dental masters of doing dentures, they take out your teeth, like say it was June 1st, they take out your teeth on June 1st and say, oh, I'll see you in 3 to 6 months. And then they make your dentures. This day and age, people can't do that. They just can't go without teeth for 3 to 6 months. And actually it's found that placing the denture the same day the teeth are taken out, it's called an immediate denture, actually preserves bone over the years versus the old way that we used to do things. So to answer the question simply, you walk in, you get the teeth out, and you get the denture right away. Sometimes we have to put a soft lining in there to make it suction down and fit a little bit better, but you never really have to go without teeth. A lot of patients ask, how do we go about doing this, going from point A to point B? It's not that difficult, but the way I've done it for many years is I start with preliminary impressions so I can get a mold of their mouth, and then from there we design a custom tray, and from that custom tray we make a final impression in a more rigid material and much more accurate material. From that, depending on how many teeth there are in the mouth, we may do a try-in. If they have a lot of teeth that you can't really do a try-in, then we'll go straight from that point to the final surgical day. If they do have enough missing teeth that we can do, it's called a bite rim, an occlusion rim, then we'll try that in so we can measure the nose to chin distance so that we know exactly how open to make people. We don't want people all closed down or way open. Once we do that, do the final setup where I have all the teeth set in wax and have the patient come in and they can sit and look at them. Once we do that final try-in, whether we're doing the surgery here or we send it to one of the surgeons to take out all the teeth, that day then they'll go to the surgeon and have the teeth removed, and then they come here and I fit the denture. I'll try it in, see if I need to put a soft lining in there, adjust the bite as we need to, it's usually really close, and then we'll see them the next day, or depending on how many teeth they had extracted, might be a week, check that soft lining, and just kind of go from there, depending on, do we need to see them 2 weeks, see them in a month. Each case is a little bit different, but that's the general protocol of how we like to do things.